Welcome to Orthodontics 101. I'm Dr. Steven Sevenik. I've been practicing orthodontics in my general practice since 1986. Through this tape series, we're going to show you how to perform orthodontics in your general practice. Why do orthodontics? What is orthodontics? Let's cover these first two questions in our discussion. Orthodontics is the straightening and alignment of teeth in their proper position in the dental arch so that you can bring your patient better aesthetics and better function. This is a wonderful service that you can perform for your patients. Orthodontics is the alignment of teeth in the dental arches. This provides a valuable service for both you and your patients. This brings about wonderful smiles and improves the periodontal health of your patients, as well as the occlusion, which is the way the teeth come together. This brings wonderful benefits to both you, your patients, and your staff, and you will find it very rewarding. Orthodontics is one of the disciplines of dentistry that can be performed in the general practice. This is a wonderful addition to what you already do. We're going to show you how you can do exactly just that. I'm going to discuss with you now the different types of orthodontic treatment that you can offer to your patients. Interceptive treatment. Interceptive treatment is the treatment of jaws in young adults, usually ages 6 to 9, in which the dentist foresees a problem, either the size of the teeth in the arch or the position or shape of the arches themselves. Functional treatment. Functional treatment uses various orthodontic appliances, often fabricated in a laboratory, for intercepting skeletal or dental malformations. Functional treatment can also be used in conjunction with traditional bracketed appliances to correct one's bite and appearance. Traditional brackets. These are often referred to as braces. These can come in many forms, the earliest of which is metal braces. Metal braces are wonderful and are still applicable in many orthodontic cases. You can add this to your armamentarium in the dental office to provide a wide range of services for both children and adults. Clear brackets. Clear brackets are an evolution of the traditional metal brackets. Clear brackets offer a more aesthetic form of dental treatment rather than the traditional metal brackets. Self-ligating brackets. Self-ligating brackets are a natural evolution of the traditional metal brackets. These provide a much wider range of dependability for the practitioner to take and guide his patient through orthodontic treatment. Clear aligners. Clear aligners are a new innovative method for moving teeth. There are many sources of clear aligners available. An up-and-coming and very popular method is ClearCorrect. These allow the patient a very wide range of aesthetic appeal to guide them through treatment, of which they have a fair amount of control. Orthodontic limitations. While most orthodontic cases are readily treatable by the general dentist, there are some exceptions. Please let the dentist make the final diagnostic decision. Patients with periodontal concerns, there are studies that have actually shown that orthodontics can improve the bone levels, and once well maintained with periodontal therapy, these patients can greatly benefit from having their teeth better positioned to keep them clean and give them a stronger position in the jaws. Orthodontics will unravel teeth so that it's more easily accessible to different parts, particularly between the teeth. Also, it'll make the bite more even so that pressure is applied more equally across all the teeth rather than a few teeth. It can actually reduce wear of the dental crown. Once periodontal therapy has been initiated and the patient is stable, orthodontics can help in stabilizing the jaw, getting the teeth aligned to equalize the pressure across all the teeth. It'll also unravel the teeth and make cleaning between the teeth much easier for the patient. Now, this whole process will also enhance the patient's self-esteem and help them want to keep their teeth clean, pay attention to the details of oral hygiene and the periodontal process. This is a wonderful way to help your patient. It can reduce wear on the teeth, balance the occlusion so that when a patient does bite, the pressures are equal, as I mentioned before, and reduce wear and strengthen the periodontium in each patient. Orthodontics can be done on a patient of any age. I've had treated patients as old as 80, patients as young as 5. There is really no age limit. how you treat at different age levels is important, and there are certain limitations in adults, but nonetheless, all patient ages are eligible for orthodontic treatment. In younger patients, we often diagnose from panoramic x-rays, and we can relate the permanent tooth size to the jaw that now exists. By looking at those two factors, even though the baby teeth may appear to be straight, there may not be room for the permanent teeth. We can adjust the jaws accordingly to accommodate the adult teeth. In some younger patients, brackets are appropriate. Otherwise, they may be used in conjunction with appliances, such as functional appliances, as we had mentioned. The treatment time of orthodontics can vary from patient to patient. In younger patients, say in the 5 to 9-year-old range, treatment may be 9 to 12 months, sometimes shorter. In adults, it can vary anywhere from 12 to 24 months, depending on the age of the patient and the needs of the patient's specific condition. Orthodontic care is really quite comfortable. You'll be surprised at how well your patients do in this treatment. Functional orthodontics is the use of dental appliances, often fabricated by a laboratory, to influence the growth structure of the dental arches and the way they function together, hence the word functional orthodontics. Okay, the patient actually has to function on the appliance to make the appliance perform its function and actually help influence the way the jaws grow. Functional appliances have many names. A typical one used is called a twin block. It's a large piece of acrylic that the patient wears in the mouth and actually bites into it. And the motion of the biting on the appliance causes and influences the jaws to grow and move in different directions. Another functional appliance is a sagittal appliance. A sagittal appliance will influence the transverse or sideways growth of the jaw with use of a screw or springs. Most patients can be referred to our office for orthodontics. Age is irrelevant, it does not matter. They can be any age from 5 up to 80. And there are very few parameters where a patient could not enjoy the benefit of orthodontics. Orthodontics handles many types of malalignments of the teeth and jaws. Just about any person is eligible for orthodontics. Anyone can be helped. Teeth that are malposed, teeth that are out of alignment, teeth that are difficult to clean, these are all situations that orthodontics can help.